Hello guys, my name is Cecilia Munga. This is my presentation for week nine milestone, which I did it alone. My group members were unable to get to week 9. Some deferred, and yeah, I was forced to do this by myself. And the GCGO project that I've been doing over the few couple of weeks, it's about healthcare. And in week 8, my wireframes were about developing a mobile application called ePonya. ePonya, E for electronic, or, ePonya, it's a digital app that can be accessible in all smartphones in both Android and iOS. So the ePonya application is what I'm going to explain and relate it to my problem statement and how that technology can be used to solve the problem of tuberculosis in Kenya. And these results can also be applied to bring solutions to communicable diseases across Africa. Well, as I've mentioned, use of ePonya technology is to address the issue of communicable diseases, specifically in Kenya. Yes, and I was allocated group 106, and I am doing this presentation by myself. The first slide contains the problem statement of my presentation and of the project that I've been covering over the first and the second month in ALX. And the problem statement reads, communicable diseases, particularly tuberculosis, pose a significant threat to global health, impacting disadvantaged populations in Kenya, the inability to afford a healthy lifestyle, contributing to increased morbidity and mortality, and thus hindering socioeconomic development and placing strain on healthcare systems. That's basically my problem statement. It talks about the communicable diseases, and mainly TB, and how it is affecting individuals both in urban and rural areas, the various population, the age groups being affected, and how this has affected basically the productivity of the nation and, economy at large. Well, the reason as to why this problem matters is addressing the issue of communicable disease, particularly TB matters. It's because, as I've mentioned, TB has greatly affected the productivity in the workplaces, because this disease is not limited to affecting only children, as many people may assume, or people with HIV and AIDS, but it can be contracted by anyone. And actually, based on the data that I collected, this disease, TB particularly, is affecting the age. It's more prevalent amongst people between ages of 20 and 50 years old, and that is the workforce. That's the highest population that are in the workplaces, who are more productive based because of their energy and their equipment, their skills, and also they are super active at that particular age. And when they are affected by that disease, that means their productivity is reduced, and that affect the economy of the country at large. The other reason as to why this problem matters is because of the burden that it imposes on the healthcare systems. As we all know, TB treatment is quite expensive, and once that great number of people are affected by the disease, that means the government is forced to provide care for those individuals, and sometimes this may not be possible, especially for the developing countries, and that increases the burden on the healthcare systems. In my next slides is a continuation of why this problem matters. I've highlighted this part because it is very crucial, and I'm going to read it. And the need for sustainable solutions. Short-term intervention may provide temporal relief. That's why this problem matters, because Well, over the years, let me say over the decades that have passed, there has not been quite a good solution to solving this problem. Many people are just coming up with temporal prevention and curbing measures, which in the end are not able to like curb it completely or even prevent it completely. And that's why there is a need to incorporate technology on finding out how this can be improved. The other sustainable solution is the investment in preventive measures. Early detection and accessible treatment facilities are imperative for lasting impact. A comprehensive strategy that addresses both the medical and socioeconomic aspect is essential for creating a resilient healthcare system. In my next slide is regards the summary of the affected population, and especially in Kenya. And as I had earlier mentioned, it affects both people in the rural and urban areas and people of all ages, but it's most prevalent among people between the ages of 20 and 50. And it is also more prevalent in the urban centers where where the population is quite dense compared to urban areas where people are scarcely populated. In continuation of my data, tuberculosis prevalence in the last couple of years in Kenya, in 1 year, there are reports of over approximately 120 new cases of TB infection, and in 1 year, the mortality or the death cases of people succumbing from TB is approximately 18,000, which is quite a bigger number, amounting to around 6% of the total mortality recorded in Kenya annually. And to based on how this disease is prevalent and the medications that the government and the various strategies that the government has put in place in investing in the treatment of the disease. The government spends over $71 million, which is quite a lot, and that's the need for a solution, a permanent solution in which this can be prevented. In this slide, the next slide shows a chart representing the data of the infected individual over the last couple of years, over the last century, from 2010 to 2020, and you can see that the population developing TB each year, it's quite high. The number of people treated as per the chart, the number of people who receive treatment are not as many because there's a scarcity of resources, and also successfully treated people are quite low, and that's why various strategies needs to be put in place to help in solving this. That one, I derived this data from a website by the Kenyan Statistics on Healthcare System, the Ministry of Health, and the link, I attached the link on my presentation, and that can be used to find out more and see the data in clarity. Yeah, that's all about the data. And in my next presentation is just a summary of how prevalent the disease is between rural and urban areas. This one, as I had mentioned, it is more prevalent in the urban areas due to the large population of individuals. And in regard to that, as we have seen, this is a major problem in Kenya, and I believe in other African countries based on my research. I believe there are various, especially that we are living in a tech-active era where technology has taken over. I think it is the high time that as individuals, as young techies, we come up with solutions based on tech on how we can improve healthcare in general and how we can come up with solutions that can help improve our healthcare systems. And in week 8, I came up with the wireframes on an app development, which is Iponya. It's a mobile app whose features are easier to navigate through and can help a patient navigate through, learn more about their health and how they can use the app to learn more about TB and other communicable diseases and how to go about them, and also how they can directly communicate with healthcare providers. Some of the features of this app include the symptom tracker, the medication reminders, and teleconsultation, and also a very important interface that I put on those wireframes that I'm going to also incorporate in my application development is the educational resource, which not only provide more information about TB, but also the treatment measures and preventative measures, as well as for other communicable diseases. And I believe in the future, I am going to improve on the app and maybe come up with more educational information regarding the same, and also improving healthcare system in Kenya. And the reason as to why, in the next slide, I explain why Iponya I was chosen, why I preferred, and why I came up with the idea of the Iponya. The decision to adopt the Iponya app as a solution for communicable diseases in Kenya, particularly TB, it was driven by several compelling reasons rooted in the unique challenges of the healthcare landscape and the potential impact on this innovative digital approach. One of the reasons is its accessibility and timely healthcare. Well, that is, well, it has information that are easily accessible, only a few data, and you can access it. And also it helps in symptom monitoring, making it easier for a patient to know when to visit a doctor. And also it has enhanced medication adherence. It helps a patient to like proper dosage and follow up smoothly on the prescription provided by their healthcare providers. Yeah, and also there are reasons as to why this this technology is likely to be effective. They include Iponya app, leverages technology for healthcare efficiency, presenting a forward-thinking and innovative approach. As I had mentioned, in this era, technology has dominated the economy and also other systems like agriculture, tourism, and also in healthcare. It is dominating those areas, and therefore Iponya is promoting that technology and is embracing the use of technology in promoting healthcare. That is one of the reasons why this application is likely to be effective. That's about Iponya, and I provided a few images on my wireframes and the prototypes of exactly what my project is all about. And in this, the first image presents a chat box between a patient and a healthcare provider, which is quite easy to navigate. In the second image, as I have mentioned earlier, the features in the application is symptoms tracking, and in this second image is just a prototype, or rather a wireframe or an image, a representation of how the app, that feature will look like. And there you can see the symptoms, and in the next two images, it's a schedule on how a patient can follow up on their medication, dosage, and prescription, time of the day, providing time of the day. This will work more like an alarm or as a reminder, making them not forget, because sometimes a patient is prone to forget about their dosage, especially when the dosage is quite, being supposed to be taken a couple of hours in a day. And in my next part of presentation regards the pain points regarding the wireframes for Iponya and the application Iponya itself, and some of these pain points include my user needs a way to contact medical healthcare providers in cases of emergencies. Also, my users need to understand the symptoms of TB, Also, my user needs a reminder or reminders of when to take their medications. The other one is my user needs therapy in cases of more than one disease. My user needs a way to locate the hospitals, the nearest hospital. Something that I had not mentioned and I've not included in my presentation is that this application has a Google map with highlighted hospitals around them, the location, so it will be easier for them in case of emergencies. They can be able to locate a healthcare facility and they get help. Yeah, that's it. And the recommendation for this project or develop this application include proposing policy changes to strengthen the regulatory framework, ensuring alignment with goals of communicable disease management. And the second one is advocating for investment in healthcare infrastructure, including the integration of ePonya app to enhance accessibility and efficiency. And the third recommendation is developing and implementing public awareness campaigns to educate communities about the importance of early detection, treatment, adherence, and preventive measures for communicable disease with a focus on destigmatizing conditions like tuberculosis. And in my other few slides talks of what next, what I'm supposed to do next as I develop this app and as I continue with this project. And my next step is to actually implement the ePonya app, to work on it and to, launch it basically and put it out there for people to use. And the other thing that I'm going to do is to establish partnership with the government and healthcare organization and local communities to ensure coordinated effort in rolling out the solution, addressing infrastructure needs and fostering community engagement. And the reason as to why I am determined to do this is because the proposed actions are crucial for immediate and long-term health of the population, providing efficient healthcare access and reducing the burden of communicable diseases. Also, by embracing these measures, not only will sustainable development be promoted, but public health will significantly improve, aligning with broader global health goals and ensuring a healthier future for the population. Thank you so much. That is my presentation. It's my pleasure that you listen. Thank you.